Hello and welcome back to Taboo Topic Tuesdays. If you are just joining me and you're thinking, who on earth is this person in front of me on my screen? My name is Georgia Spence and I am a registered associate nutritionist with the Association for Nutrition. So in summary, this means that I have undertaken appropriate training in order to be recognised by the Association for Nutrition. I'm not a nutritionist that has done a 1 or 2 day course. I'm a nutritionist that has done 3 years plus training in order to call myself a nutritionist, meaning that the practice that I perform is up to date, relevant and appropriate. But I am planning on doing a video separate to this where I sort of go into that a little bit more, maybe even a Q&A. If that is of any interest, please do let me know. So I haven't actually done a YouTube video before, but I thought that I would bring the Taboo Topic series upon this platform purely because I think a longer video is easier perhaps and nicer to watch on this platform opposed to Instagram where I normally do it. If this isn't the case, just let me know and I can go back to Instagram. And also I'm going to let you into a secret. I have no idea what I am doing on YouTube. I really have no idea how to work it. I don't know how I'm going to edit this video, but fingers crossed this makes it. But any tips, tricks, let me know and please be kind. Like I said, this is all very new to me. But the purpose, if you haven't seen the Taboo Topic series before, the purpose and the idea behind it is that I discuss and talk about subjects, topics. They don't have to be nutrition or health related, just any topic that people may feel uncomfortable discussing, they may not feel confident discussing, to really help to break down that barrier and to prove that they're just normal topics. There's no need to be embarrassed or ashamed of. But without further ado, let's crack on into the video. Let's see what this week's going to bring. So this week I decided I am going to talk about bowel movements, which I think there is such a embarrassment around that people perhaps go, oh, I don't want to talk about that. It's something that goes on behind closed doors. And yes, it is, but that doesn't mean that we can't talk about it. And it is actually really important to talk about, and the frequency and even, the structure of your bowel movements, they can actually be indicators of your overall health and are very necessary to discuss with healthcare professionals. What does a healthy bowel movement frequency look like? So it really is, along with the majority of health surrounding areas, it really is individual by individual. Everyone is different, so things like your food intake, your water intake, even things like the season can really affect the frequency of your bowel movements. However, rule of thumb that the NHS normally goes by is that 3 bowel movements a week and 3 bowel movements per day. Anywhere in between that is classified as a healthy bowel movement frequency. But like I said, it is very patient by patient, individual, and that there may be some difference to this. If you are in any way concerned, like with anything I'm going to discuss on this series or in this video, please always speak to your registered GP or healthcare professional that you feel comfortable with. So for example, that might be that if you're a female like myself, you may want to speak to a female GP or a female nurse, etc. That is available or should be available for you. So talking about now the build-up or the appearance of your bowel movement, there is something, and I will leave the link below, or I may try and insert a clip after this. I'll see how technology is behaving. There is something called the Bristol Stool Movement Chart, which is a lovely little chart. You may see this or may have seen this before if you have been in a doctor's room. I know I've seen them in varying doctors' rooms, like I say, and it has 7 different pictures, little images and visual guides of the different types of bowel movement. So I won't go into too much detail. I don't want to, really dive into that, but just as an overview, type 1 and type 2, if you are experiencing bowel movements that look like this, they may indicate that you have got diarrhea. Bowel movements 3 and 4, they may indicate that you have a normal bowel movement. These are the ideal bowel movement appearances that you want to look for. And then anything below that, so type 5, type 6 and type 7 may indicate constipation. But like I said previously, it is individual by individual. It massively can vary for an individual. But any concerns again with this, please speak to a registered professional. And like I said, I will try and insert like a little clip after this or a link below, depending upon how I get on, for you to really look over. I think it's quite important to note that these can vary from day to day, and it should be perhaps a practice that you adopt following this video, just to take a bit of a notice of how it is looking. Does it look normal to you? Does it look perhaps a little bit different to normal? Also, things like looking out for blood, that can be it is an important thing to note. If there is blood in your bowel movement, please seek medical advice, just to rule things out, just to make sure that things are passing healthily, there isn't any upset tummies or anything like that. But like I say, rule of thumb, anywhere between 3 bowel movements per day to 3 bowel movements per week, and that type 3 and type 4 bowel appearance, that is classified as healthy. So one thing that I would recommend to help improve things like your digestive health, including the frequency of your bowel movements as well as the appearance and build-up of your bowel movements, to help prevent things like diarrhea, constipation particularly, is to ensure that you are meeting the UK recommended guidelines of having 30 grams of fibre per day. So fibre really helps to keep your digestive movement, your gastrointestinal tract moving, to help the food come from your mouth down into your tummy, into your intestines, and then pushing it out through your rectum and your anus. So 30 grams of fibre is not frequently met in the UK, unfortunately. A lot of people are not meeting that recommended guideline. A lot of people are staying more around the 20 grams per day opposed to 30 grams. So ways that we can build up this fibre content in our food, you know, it doesn't have to be inexpensive, it doesn't have to be rocket science, it can be really quite simple. So choosing the higher fibre breakfast cereal options, for example, so perhaps swapping out your cornflakes for some Weetabix or some Shreddies, or perhaps choosing whole wheat pasta and rice opposed to the white type, or even bread, choosing the whole grain, the whole wheat, rather than the white sliced bread. You know, these little tips, making sure you are getting your 5 portions of fruit and vegetables a day, trying to get them 30 different types of plant-based foods in, so seeds, nuts, fruit, vegetables, pulses, lots of different things. So for example, one thing that I like doing is making, rather than having like a meat lasagna, having like a lentil lasagna, or if you really like the taste of meat, having half and half. So getting in your pulses, one thing that I love buying from supermarkets at the moment is like the cans of mixed beans and mixed pulses. So you're getting like 3 or 4 different types of beans in there, and you can chuck them into the majority of, you know, meals that you're cooking. Chili con carnes, curries, bologneses, lasagnas, stews, pies, literally everything, just chucking them in, adding some different spices, different herbs, different seeds. But I am digressing. So trying to get that 30 grams of fibre really can help you with your bowel movement frequency and the build up and the appearance of that bowel movement. And I will also include the NHS webpage on little tips and tricks on how to do that. I do also have quite a few posts on my Instagram, which again I will link below for you to look through if you aren't familiar with my Instagram page. But yeah, I think that's pretty much me for today's Taboo Topic Tuesday. Like with everything, if you've got any questions, please do ask. And I will try and link everything that I've discussed below for you to have a little nosy at. And please do let me know your thoughts on using YouTube opposed to Instagram for this series.